The traditional care for the breast cancer patients included a visit to the OPD, which usually involved a long queue in which the female patients had to wait, and then they had to wait for a female surgeon to review them. One-stop breast clinic, we are providing all the facilities under one roof on the same day.
In the battle against breast cancer, a beacon of hope emerges: one-stop breast cancer clinics. Join us as we explore these comprehensive centers designed to streamline care and provide holistic support for those facing this challenging journey. Meet the dedicated team behind the scenes at One-Stop Breast Cancer Clinics, compassionate experts committed to revolutionizing breast cancer care. What inspired the concept of one-stop breast cancer clinics, and how do they differ from traditional cancer care facilities?
The traditional care for the breast cancer patients included a visit to the OPD, which usually involved a long queue in which the female patients had to wait, and then they had to wait for a female surgeon to review them, to advise some imaging tests like the ultrasound and the mammography. The next hurdle in that process was getting the appointment for ultrasound or the mammography after the report was being issued, and there's a gap of several days when the biopsy is being done. This was the practice we had been doing for the last several years. With the inception of the One-Stop Breast Clinic, we are providing all the facilities under one roof on the same day. So this involves a consultation and examination by a female surgeon in a private environment, in a separate environment from the rest of the OPDs. The imaging tests are done on the same day and the results are provided within an hour or so, and the required biopsy is done on the same day as well. So basically, One-Stop Breast Clinic helps to cut short the time and expedite the cancer care management.
Can you highlight the key features that make these clinics a comprehensive resource for breast cancer patients?
The key features of the One-Stop Breast Clinic is providing the care with convenience in the minimum possible time and in the same setting in the presence of the female staff. With the presence of female doctor for examination, for ultrasound and for biopsy, the patients feel more comfortable, more at ease, and there is a much more economical benefit as well, as the patient does not have to come to the hospital repeatedly for these tests and does not have to wait for days for the reports. In this way, the cancer diagnosis is done as soon as possible and the treatment plan is given to the patient after a multidisciplinary team meeting.
How do advanced imaging technologies and on-site diagnostics contribute to the efficiency and accuracy of breast cancer diagnosis in these clinics?
For all the breast cancer patients, we need some kind of imaging investigations like the mammography and sometimes the CT scan and ultrasound abdomen as well for the staging purposes. With the provision of these services under the same roof in the same setting, and with the provision of the multidisciplinary team concept, all the doctors are on board. They discuss the reports of the patient and they devise a comprehensive management plan for the patient in the light of the investigations, and the diagnosis is made.
Can you share a success story that illustrates the impact of early detection facilitated by one-stop clinics?
We recently had a 28 years old lactating mother who presented to us with the complaints of pain and discharge from the breast, which she perceived to be a breast abscess. As she was a lactating mother, it is very common in the mothers who are breastfeeding to get a breast abscess. But once we did the imaging investigations, there was a suspicion of cancer according to the radiologist, and then a biopsy was done on the same day. When the reports came out, they turned out to be malignant. So what was considered to be a benign disease in a 20 years old patient turned out to be a cancer, and the treatment had to be started as soon as possible, as the cancer in younger patients is usually more aggressive and the treatment is needed at a much higher level. So this patient benefited from the concept of one-stop breast clinic because she was diagnosed properly and was saved the hassle and the long duration of time that is needed for the diagnosis.
How does the integrated approach of one-stop clinics streamline the diagnostic and treatment planning process for breast cancer patients?
The one-stop breast clinic concept basically holds and basically brings on board all the doctors concerned with the cancer care management, which include a general surgeon, which includes a breast cancer specialist, which includes a radiologist, a pathologist, and a medical oncologist. All of these doctors discuss the patient management, they reach a consensus about the diagnosis, and then the treatment option is given to the patient. With the start of the one-stop breast clinic, our patients have a higher level of satisfaction as they are provided all the services in a very limited duration of time and with the minimum possible expenses.
How does the collaboration between specialists contribute to more personalized and effective treatment plans for breast cancer patients?
Cancer care is not a single man's job. No surgeon or radiologist or an oncologist can treat a cancer patient, especially a breast cancer patient, on his own. For that, we need an integrated approach. The multidisciplinary team is the concept that is basically needed for the cancer care management in this current era. With the concept of one-stop breast clinic and multidisciplinary team meeting, we devise a management plan for the patient that is tailored cut for that particular patient, and we also have different surgical options which are being discussed in collaboration with the plastic surgery department. In this way, we are able to provide the best services to the patient in the minimum possible time and as soon as the diagnosis is made.
As we conclude our journey through one-stop breast cancer clinics, we celebrate the innovation, compassion, and hope these clinics bring to individuals facing breast cancer. In this haven of care, the journey becomes a collective effort towards healing and resilience.